Okay, hi, good morning. My name is Karl Hanzel, as Leslie George just mentioned. And my role is to ensure that we abide by the safety regulations for the School of Medicine and also Cardiff University. So I'm just going to give you a brief overview. I intend to sort of scratch the surface of safety. I don't want to bog you into too much detail, but ultimately I just want to cover some of the main issues that you may sort of come into contact with. Okay, well, obviously you've just seen a plan view of the place, but just to put you some perspective, you were based there, and my position within the school is to kind of look after many of these sites, the external buildings and also the main buildings, not the dental school area, but the 10 of us, WHRI, the Henry Wellcome building, the C&G building, not TDA, we stand, the Michael Griffith, which is the new lecture theatre. Again, they're controlled directly by Cardiff University, and also in time, well, very shortly, the Cochrane building. Now, just put you into some perspective, as Leslie Jones mentioned, we've recently gone through a new structure within the school based into institutes, and each institute will have their own formal safety policies in due course. Okay, so the main point of this is to get to know and get familiar with your actual area of concern. Okay, so wherever you're based, get familiar with the safety within that locality. Okay, so the main objectives for health and safety comes down to the university's responsibilities. Now, the Vice-Chancellor, he has overarching responsibility for safety for all staff and students within Cardiff University. Now, he devolves safety responsibilities down to each dean of each school, and consequently down from the dean through, as it was, the head of departments, but now to institute heads, through to local area representatives in safety, and also and then down to supervisors, students, and other staff members. So that's essentially what the structure is. We all have duties of care to abide by. We need to make sure that we maintain safe systems of work, and also adhere to any sort of regulations that may become, that may be handed to you or maybe expected of you. Again, you also have a duty of care to behave in accordance with the local regulations, and to ensure the safety of yourselves and also those around you. Okay, so it's important for you to be vigilant and again get familiar with your locality. We have an incident reporting procedure, so if any incident occurs, I'll go into speak about this in slightly more detail later, then that needs to be reported. So even sort of minor incidents is all important in the whole chain, so we get to develop better systems of work in the future. Okay, and again, the university policies and procedures need to be adhered to at all times. Right, these are some of the key contacts. I'm in direct communication with OSHU, as they call it, the Occupational Safety and Health and Environment Unit. Those are some of the key contacts. Again, you'll have a handout of this, so you don't need to remember any of this. And Mike Sabansky and Dr. Sheridan Morgan, they are our liaison officers that I deal directly with between ourselves and Cardiff University's safety department. So we've got a very sort of close working relationship, and we deal with all manner of issues to do with safety throughout the school. And again, those are some of the contacts if you need there for OSHU, and also for UHW Health and Safety, which is based in Denby House. Okay, if you detect a fire or if you hear a continuous fire alarm sounding, then please evacuate the buildings. Again, depending on where you are within your facility, please get to know who your fire warden is. There should be, and look at signage. Okay, as you can see here, you've got the green signs which basically send you to a safe area. Okay, the assembly point for this particular area is the dental school. So if a fire alarm was to sound, then we would evacuate and get you to assemble outside the dental school. Okay. If you do notice a fire, please raise the alarm and inform a member of staff. And if you can't find anyone, probably please call 3333 anywhere on site, and that will get you through to the emergency services and get a fire engineer immediately. Okay. The vacate the school medical school entrance there again depends on your locality, so please familiarise yourself with wherever you're based, where the actual evacuation points are. Again, that all the threes can actually be used, not necessarily directly for any fire-related issues, but they can also be used for any, if you feel that there's a threat of violence, or you've seen someone that's been seriously injured, or you can call an ambulance. You can also use all the threes for that. If you suspect someone of cardiac arrest, again, hopefully the first aider will be on hand. Again, familiarise yourself with who the first aiders are for your area. But we have a crash team on site. If you call all the twos, they will attend to you. Just give them the location, and they can be there within minutes. Okay, again, I'm not going to sort of go into the details, but these are the, based from the Health and Safety at Work Act, these are some of the statutory instruments that are in place in order for us to give us guidelines to maintain sort of safety throughout the School of Medicine. Again, this is just a sample of some of these. There's quite a lot more of these, but again, I don't want to bog you down with too much detail there. You just need to be familiar with your locality and your risk assessments, which again we shall go on to. Okay, so why do we need to comply with it? Well, it allows you to go ahead with work safely. It maintains safe systems of work, as I mentioned. But the Health and Safety Executive, which is a government body, can serve improvement notice. So they can inspect at any given time. They can come into any laboratory area, any office area. And if they see something that's in breach of the current regulations, then they can say, right, you need to improve this area. We'll give you a fixed time frame, maybe 6 months to get it sorted. If you don't, then they can issue a prohibition notice. If it's very severely bad from the word go, which thankfully on site it shouldn't be, but they can serve a prohibition notice. So essentially they can say, right, please get out of the lab, this laboratory is closed down. So again, it's down to sort of individuals' behaviour and people maybe not attending or not abiding by local rules, that these sort of issues can come up. But my role and local area safety representation puts a stop to this, or at least prevents this from occurring, hopefully. And again, the breaches of safety regulation can lead to a prosecution, fines or imprisonment. So it is a serious issue that hopefully you'll take seriously. Okay, I've mentioned the incident reporting system. Again, there's an online form to do with this. So if you do get any incident of any kind, which I'll mention later on, then please report that to your supervisor or your local safety representative. Again, that's just what the actual website looks like. You can't really see it very well there, but that's the web address. Again, there's loads of information there which I can't go over now, but please use it. Currently, the School of Medicine, we're working towards getting a safety website, but again we haven't got that at this stage, but we're working towards that. But please use the OSHA website because there's plenty of good information there. Again, part of the legislation there, the management of health and safety work regulations, and that just shows what the duties of the employees or supervisors are to you. Again, I don't want to go into too much detail with this, but please, as you've seen, you will all receive a code of practice, and so will your supervisors. And in that, you will get an overview of what responsibilities are and what you need to do in terms of safety. Up there, one of the most fundamental things is risk assessment. Make sure that each work activity that you come into contact with has had the significant hazards addressed, and you can deal with any issues you have in a lab, and you can refer to that at any given time to make sure that you can prevent, if possible, any hazards you might be exposed to, or at least control them. Okay, but again, please discuss this directly with your supervisors. They're probably going to be in place anyway, most risk assessments. But if you have a certain piece of work that you're going to carry out that's specific and unique to your own setup, then again you need to go through and develop your own risk assessments. Currently online, there's a team place through Cardiff Mail where you can actually access risk assessments that we've sort of accumulated for the School of Medicine, and that will help you and guide you through the risk assessment sort of process. But if you have any concerns about dealing with risk assessments, you can always contact myself or your supervisor. I'm sure they'll be able to work through that with you. Again, and as it says, the duties of the students, just, they must make sure that safety facilities are provided for you, and that you use those accordingly. Okay, those are a list of the types of hazards you may be exposed to, from physical, electrical radiation, any other substance, biological agents, ergonomic risks, students, what they can be like, and fire and explosion cylinders and so on. One which isn't actually added there, and which you probably will face to a greater or lesser extent, is stress. And this is often it's a poo-pooed subject, but it's a very important subject as well. So if you ever feel that you may be under any stress, and you will be, but if it becomes too much, then there's provision in place via occupational health. And obviously, please talk to your mentors or supervisors or someone that you trust, maybe an older colleague that's maybe in an older, year 3 or 4 of the postgrad, or any other member of staff, and there's facilities for you if you require that. Okay. Okay, this just gives you an overview of how to work out what's the nature of the risk you might be faced with. Again, not too much detail, but the likelihood is 0 if it's very low risk to almost certain that it's going to happen, through the severity of 0 if there's no injury or illness, through to 5 fatality or disabling injury. Again, not too much detail, but please check with your supervisors that your risk assessments are in place. That's just a picture of a member of staff that may be exposed to series of risks. It could be anything from slippery floor. Is the chair appropriate for her needs? Is she going to be exposed to any possible UV radiation? What's she looking at? Is that a safety issue? Is her posture important? Is she working with anyone in that environment and maybe using chemicals that she's not aware of? So please just be familiar with your surroundings. So if you have any concerns that your area may be a bit, it's untidy, or you think there's a spill that you don't want to deal with, please discuss this with your supervisor and make sure that everyone within your area is aware of what you're doing and what everyone within your area is also doing. Again, it's not just restricted to laboratory spaces. I mean, a lot of the focus of safety tends to be within laboratory environments, but also, office safety is important as well. I mean, and you're probably going to spend hours and hours hunched over laptops or video screens and so on when you're data processors. So again, please, there's statutory legislation in place, the DSC regulations, to make sure that you actually, your posture is appropriate and the chair you use is appropriate while working within a working environment. So as you can see there, that's probably not the best position for her to be in. She's probably comfortable with that, but there's not much of a wrist rest, for example. The chair is not adjustable. It's a cluttered surface. So please be aware that of your working environment, and there are mechanisms in place locally to improve your workstations. Again, I'm not going to talk too much about COSH, but that's basically embedded in the risk assessment. We try wherever possible to prevent any exposure to any hazards, but when we can't, we try to adequately control these. Oops. And sorry, that's just what COSH requires. Assessment of risk, prevent, control, what control measures you need, and if there's any health surveillance required, and any information and training you can get. These are some, from biological safety, importantly, you have microbiological safety cabinets, but you also have fume cabinets. So please make sure that you've received sufficient training in the use of these. Again, locally you should have a building induction, and you should be sent in directions of people with expertise in the use of this equipment. If you haven't, please raise it with your supervisor or your mentor or another member of staff to make sure that you do, because it's very important what you actually use in this, especially from a point of view of decontamination or disinfectant, how you handle a spill, for example, and making sure that you use the correct equipment in the correct area. Okay, so again, just familiarise yourself with that. That's some information if you require more guidance in terms of biological safety. Some of you may need to work with liquid nitrogen, and again we have a golden rule regarding liquid nitrogen, and the fact that we use it throughout the school in very many areas, which can be a problem because we're handling quite a lot of quantities of this in various locations. The main thing is to not accompany any liquid nitrogen in a lift. We have systems in place where we can lock down lifts, and they can be sent to floors above, and then someone can ooze on, say, from the ground floor up to the third floor, can then sort of withdraw that container. We also have systems in place for testing pressurised vessels. Not all of them are pressurised vessels, but we've got systems in place to check those. Again, if you are in a laboratory area and you're a bit concerned that you see a lot of these around, and for some reason there doesn't seem to be any sort of monitors there, or the ventilation seems to be, well, you can't actually see where the ventilation is, and please check, and please just inquire, you know, as you would with your PhD, just inquire and ask questions, you know, is this safe, can I work in this area? Okay, so you know, no one will think any less of you, and it's very important you do so. Okay, and again, use appropriate PPE. That's personal protective equipment. If any of you are going to be working with radiation, these are the key contacts, and please, before you do any radiation work, find out who your local radiation protection supervisor is. They're throughout the school, again, and if you are going to be working with any radiation, they're very quick sort of to pick up on that fact, because you need to order, if you need to order any isotopes, then you need to go through ISOstock, which is an ordering system, and they will find out about that. So please, again, familiarise yourself with who your local radiation protection supervisor is, and they can do all the necessary paperwork. That's what you need to do in the event of sharp and needle stick injury. Again, I don't want to go into too much details about that, but this sort of ties in with the incident reporting thing. If you do get a needle stick injury, then this is the sequence of events that you need to adhere to. Okay, I don't want to really go into too much depth with this, but essentially it's form filling and go into occupational health. That's not to scare anyone, violence, but it's just to kind of highlight the fact that you also need to be aware of security within the school. Again, we're on a hospital site, so it's very open. It's a very sort of a free environment, you know, for patients and staff and students alike. But the main areas, the outlying buildings, so for example, the Tenevus, WHRI, Henry Wellcome, and so on, this security, you know, card bypass that you need for that. Okay, so what you need to do is check with the receptionists and to make sure that you've actually got enough. You know, you've got your ID passes. Make sure that you display these at all times, and make sure that they're activated accordingly. That's the lone worker policy. If you do intend to work out of hours, please adhere to this. Again, all the details are available. Make sure that you close doors behind you when you are working alone, so you know no one can come in and tailgate you. Ensure that you know who your first aider is for the area. Again, this should be displayed on notice boards, but again, just ask the questions, and this should be highlighted at your local inductions. If you require emergency medical aid, that's the number to call, and the ambulance via all the threes. Look at the safety signs and see how they apply to your area. Make sure that where you are working is covered, and that's what they are. We have waste segregation on site, so any clinical waste should go in yellow bags that's contaminated with anything medicinal or chemical. We also have orange bags within the main building, but again, I won't go into too much detail with that, but please ask locally how you need to dispose of specific waste. We have a PAT, an external contractor that comes in and checks all electrical equipment. So again, this shouldn't really concern you. Please just check any equipment you have. Please don't bring in any electrical equipment from home that's unless it's been sort of checked first. Some of the health surveillance concerns you may be concerned by. You may need to have hepatitis B inoculation. Again, check through occupational health. You may also need Vitalograph screening, which is the Vitalograph pump there, to minimise sort of overall exposure. And if anyone falls pregnant, again, please inform your supervisor and also occupational health, because again, you will need to have sort of risk assessment to make sure that your environment is fit for purpose. You should, again, we've got a duty of care to make sure that you undertake induction. Again, within your locality, you should have induction programs in place. If you don't, please let me know. Familiarise yourself with the task. Make sure what regulations apply to you. Check what the significant hazards are. And again, liaise with your supervisor and mentor on this. Okay. So, register with occupational health if you haven't done so already. Make sure you get the appropriate training, speak to your supervisor or local representative. Follow all the procedures. Report any incidents. Report any faulty or damaged equipment. Use any equipment properly and check. And use appropriate personal protective equipment where appropriate. And it's everyone's responsibility, so please take it seriously. Again, if you need any further information, that's my detail there. You'll have the handout, all the information is there. Please don't hesitate to contact me, and thanks for listening.
Thanks.